Welcome to the deep dive. Today, we're venturing into a topic that might not immediately spring to mind when we think about our furry friends. Heart attacks in dogs and cats.
Right. We hear about myocardial infarction all the time in human health, don't we?
Exactly. But we've got some really interesting clinical material here, looking at it from the veterinary side. It's kind of like uncovering a hidden aspect of pet health.
Yeah, definitely. And we're going to explore what myocardial infarction actually is for dogs and cats,
Yeah.
what signs you, as an owner, might spot, and how vets actually figure this out, because it is pretty uncommon.
Okay.
So the mission really is to pull out the key info, clarify why it's different from humans, which is important, and just give you a clearer picture.
Great. So let's get right into it. What exactly is myocardial infarction in pets, based on what we've read?
Well, fundamentally, it's the same definitions as in humans.
Yeah.
It means rapid death of heart muscle cells. And that happens because the blood supply to a part of that heart muscle gets completely blocked and stays blocked. Usually it's a blood clot, a thrombus.
Right, a thrombus. And the really crucial point here, which you mentioned, is that this isn't common, is it? Not like in people.
Exactly. The sources really stress that. Naturally occurring myocardial infarction is uncommon in dogs and cats. That's a huge difference from human cardiology.
That's significant.
It is. Although, interestingly, the material does say that vets do often find microscopic evidence, like tiny areas of damage or scarring, focal fibrosis they call it, inside the heart muscle of dogs that already have other cardiovascular diseases.
So even if a big classic heart attack is rare, smaller things might be happening.
Sort of like mini events, yeah. It suggests there can still be damage accumulating, even if it doesn't present as a full-blown infarction.
Okay, that makes sense. And the sources also touch on ECG's electrocardiogram, saying it's hard to consistently spot the typical signs of a spontaneous heart attack in pets. Why is that?
Well, that's a good point. The heart's electrical signals are complex, right? And lots of things can affect them.
Mm-hmm.
With a complete blockage, you'd think you'd see really clear ECG changes. But the sources suggest that in dogs and cats, maybe those changes are less predictable, or perhaps they get masked by other underlying heart problems the animal already has.
Right. Or maybe it had so fast.
That could be part of it too.
Yeah.
So yeah, it doesn't always leave that classic, clear electrical signature that you might expect.
Okay. So thinking about the owner's perspective then, what might you actually see? What are the historical signs mentioned?
The sources list quite a few things someone might notice over time. Lethargy is a big one, just being much more tired than usual.
Right.
Loss of appetite, anorexia, general weakness, difficulty breathing, which vets call dyspnea.
Dyspnea.
Okay.
Yeah.
And then more severe signs like collapse or even vomiting. And tragically, sometimes the very first sign is, well, unexpected death.
Wow.
Obesity is also mentioned, though perhaps more as a risk factor than a direct sign itself.
And what about when a vet examines the pet? What physical things might they pick up on?
During the exam, a vet might find things like lameness, which seems a bit odd, but it's listed.
Yeah.
A rapid heartbeat tachycardia, maybe a heart murmur they hadn't heard before, or irregular heart rhythms, cardiac rhythm disturbances.
So the beat isn't steady.
Exactly. And sometimes even a low-grade fever might show up.
So quite a range of things, some obvious, some maybe less so. Let's talk about the why. What are the underlying causes or risk factors listed for dogs?
For dogs, it's quite a list, actually. It includes things we associate with humans, like atherosclerosis and coronary artery disease, though maybe not the top primary causes in dogs.
Interesting.
Other things mentioned are nephrotic syndrome, that's a kidney issue, different types of vasculitis, which is blood vessel inflammation,
Okay.
hypothyroidism, low thyroid, bacterial endocarditis, an infection in the heart, cancer or neoplasia, septicemia, which is a bad bloodstream infection, and also something called intramural coronary arteriosclerosis, seen more in older dogs, and even a specific heart defect, subvalvular aortic stenosis. It's a real mix.
It really is. Quite diverse. What about for cats? Is it different?
For cats, it seems a bit more focused, based on our sources.
Yeah.
The main associations are with cardiomyopathy, that's disease of the heart muscle itself,
Right.
and thromboembolism. So blood clots forming and blocking things. It seems in cats, having a pre-existing heart muscle problem is often a key factor.
Okay, so a weaker heart muscle to begin with is a big risk in cats. Now, putting all this together, how does a vet actually diagnose this? It sounds potentially tricky.
Yeah, the sources say the diagnosis is often presumptive,
Presumptive meaning.
meaning They make the best educated guess based on the combination of factors, like the sudden onset of those signs we discussed,
Hmm.
especially if the pet already has known risk factors.
Right.
And the ECG findings are still important,
Right.
even if not always perfectly clear-cut. The sources specifically mention looking for consistent changes, particularly in the ST segment of the ECG trace.
The ST segment. Can you explain that a bit?
Yeah, think of the ECG wave like a little electrical journey the heart takes with each beat. The ST segment is part of the recovery phase after the main contraction. If that segment is suddenly way higher or lower than normal, it's a strong clue that there's been injury to the heart muscle.
Okay, that makes sense. And the source had a figure 1, showing an example ECG.
Yes, exactly. It showed what's called a transmural infarction, meaning the damage went through the whole muscle wall in a dog that had both arteriosclerosis and hypothyroidism.
And what did that look like on the ECG?
Well, first it showed this really fast, chaotic rhythm ventricular tachycardia. Very dangerous. Then, when the rhythm briefly stabilized, you could see these small QRS complexes, the main spike of the heartbeat, and that ST segment elevation we just talked about, clearly higher than it should be.
Okay.
And also a longer PR interval, suggesting the electrical signal was taking longer to get through the heart. It really paints a picture of electrical chaos.
Definitely helps visualize it. But like you said, diagnosis is presumptive, so there must be other things that can cause similar signs or ECG changes. What are the differential diagnoses?
Good point. For those ST segment changes specifically, there are other possibilities. It could just be a normal variation for that particular animal sometimes.
Okay.
Or it could be myocardial ischemia or hypoxia, so reduced oxygen to the heart, but not a total blockage yet.
Yeah.
Electrolyte imbalances like potassium being too high or too low,
Right.
toxicity from certain heart medications like digitalis, actual trauma to the heart, pericarditis, inflammation of the sac around the heart, or even just technical issues with the ECG machine, like a wandering baseline artifact.
Lots to roll out just on the ECG. And what about the general signs like weakness or collapse?
For those symptoms, the list includes things like physical trauma, obviously, neurological diseases, thromboembolism again, but maybe affecting the lungs or legs rather than causing the heart attack itself in dogs. Pericardial effusion, fluid buildup around the heart, which can cause collapse, and other kinds of arrhythmias, just different abnormal heart rhythms.
So a thorough workup is definitely needed. What about blood tests and imaging? What can they add to the picture?
Blood work can be very helpful. You might see a mild increase in white blood cell count, leukocytosis. Liver enzymes might be elevated. You might see high levels of fats, hyperlipidemia, especially if hypothyroidism is involved.
Okay.
Amylase might be up. And crucially, you often see elevations in enzymes like creatine kinase, CK, and specific cardiac isoenzymes. These are released when muscle tissue, especially heart muscle, is damaged.
Markers of muscle damage.
Exactly. And if hypothyroidism is suspected, you check T4 and T3 levels, expecting them to be low.
And imaging, ultrasound.
Echocardiography, yes.
Oh.
Ultrasound of the heart, both 2D and MMOS views are really useful. They let the vet actually see the heart muscle.
What are they looking for?
They're looking for wall motion abnormalities, parts of the heart wall that aren't contracting properly because they've been damaged. And they can assess the overall pumping function of the left ventricle, which is often compromised after an infarction.
Got it. And just circling back quickly to the ECG, the sources listed some other potential findings besides the ST changes, right?
Yeah, there's a more detailed list. You might see tall, pointy T waves early on. New Q waves might appear, or the direction of the T waves might flip.
Okay.
The overall electrical axis of the heart could shift. The QRS complexes might become really small, low voltage. You could suddenly see a new bundle branch block or another type of heart block appear.
So problems with the electrical wiring.
Exactly.
Yeah.
Or sudden ventricular arrhythmias popping up because of the lack of oxygen. And there's even a subtle sign mentioned, a sloppy R-wave descent, which might hint at damage within the muscle wall. It's complex stuff to interpret.
It really sounds like it. So let's move to treatment. If a pet is diagnosed, presumptively or otherwise, what's the approach?
It's really two main things. First, you absolutely have to try and identify and treat whatever underlying condition led to the infarction, if possible.
Makes sense. Treat the cause.
Right. And second, you provide symptomatic therapy. So if the pet is showing signs of congestive heart failure, you manage that. And critically, as we mentioned with the ECGs, you have to identify and treat any life-threatening arrhythmias immediately.
Okay. What about specific drugs mentioned in the sources?
Well, they mentioned thrombolytic agents, clot busters like streptokinase,
Right.
but they also add a big caveat. These are often very expensive for veterinary use, and there's just not a lot of solid data on the best doses or protocols for pets with MI.
So used cautiously, if at all.
Probably. Lidocaine is mentioned specifically for treating those dangerous ventricular
Okay.
arrhythmias. Beta blockers might have a role, but again with a caution. If the pet has dilated cardiomyopathy at weeks, enlarged heart beta blockers could potentially make low-output heart failure worse. So careful selection is needed.
And drugs to prevent more clots.
Yes, antithrombotic agents. Things like dolteparin, low molecular weight heparin, regular heparin, even aspirin might be considered to help prevent further clot formation.
Okay. And what about follow-up care?
Follow-up really hinges on how the pet is doing clinically and what the underlying diagnosis was. If they're on anticoagulants like heparin or aspirin, they need careful monitoring with blood test CBCs and bleeding profiles to make sure the dose is right, and they aren't having issues with bleeding.
Right, balancing clotting prevention with bleeding risk. So let's bring this all back to you, the listener. Why is knowing all this relevant if, as we keep saying, this is relatively rare?
Well, I think understanding the potential signs, even the subtle ones like lethargy or appetite changes, and knowing the risk factors can make you a more observant owner.
Yeah.
If you see a sudden, significant change, maybe this information prompts you to think, could this be heart-related? And talk to your vet sooner rather than later.
And also recognizing it looks different in pets than people.
Exactly. You're probably not going to see your dog clutching his chest. It might be more general signs of being unwell or weak. Knowing that difference is key.
This has been incredibly informative, a really deep dive into something not often discussed. So, to summarize quickly, myocardial infarction in dogs and cats, it's rare, serious, has specific signs, often linked to underlying issues different from humans. Diagnosis involves piecing together clinical signs and diagnostics like ECG.
Absolutely. And that leads to a final thought perhaps for you listening. Given this complexity and the link to underlying diseases, what other changes in your pet's health, things that might seem totally unrelated, could potentially warrant a chat with your vet about cardiovascular health? Kind of encourages a more holistic view, doesn't it? Thinking about how different body systems might be connected in ways we don't always immediately see.